Hello and welcome. We are going to discuss about feeding issues in children with autism and how we are going to tackle it. Children with autism have a lot of issues with their feeding, and that is the greatest challenge for their parents as well. They are very selective in terms of food, and often they are seen to be picky eaters or problem feeders. And they have, when we look into what all they have in a day, it will be very few countable food items, and usually it will be more starchy and sweet food items. So let's see what all are the causes of, or could be the causes of these feeding issues, and how we can manage them. So the feeding issues in children with autism could be due to sensory motor issues or behavioral problems or environmental problems. Let's have a look into each in detail. About sensory motor issues, it could be oral sensory motor, that is oral motor in the sense the movement of the jaw, the tongue, the oral structures, the coordination of the movement, etc. comes under the oral motor. And in oral sensory, it is the way your tissues perceive each senses, that is the taste, the smell of the food, the texture of the food, etc. All these comes under the oral sensory part. Sensory can be a very, not only oral sensory, it can be all over the body. The sensory issues can affect the way they behave in a meal time. And these sensory, oral, motor and sensory issues are controlled by the nervous system. We know that autism is a neurodevelopmental disorder, and it is very obvious that it could be the neurological peculiarities that could lead to these oral sensory motor issues as well. And also, we should be aware of the feeding pattern of children. That is, the children process through a definite pattern or a developmental pattern in feeding. That is, they move from breastfeeding to purees and then to transitioning to semi-solid solids and then to table foods, etc. So there is this definite sensitivity period wherein they start moving from or transitioning from each food to the next. So if we are starting or moving on to the transition very early, or if we are waiting so long, both these can lead to oral sensory motor issues. Now let's look into the sensory motor issues of children with autism in detail. First, let us look into the taste. They could be hypersensitive to taste or hyposensitive to taste. That is, they will be liking a particular taste a lot, or they may not like different some textures or some taste. And next would be sight or the vision. They could be seeking, they like very colorfully presented food, and sometimes they don't like dull food items that are not visually very appealing for them. So the way the table is arranged, the shape of the food, all these can lead to visual sensory stresses. Then smell. We have seen that children with autism usually smell edible and non-edible. They have a tendency, not all, but few children have a tendency to smell all the things that they take in their hand. So this happens with food also. They may sometimes like a particular smell a lot, or sometimes they will not like the smell of the food and they may avoid having meal or having food. And for touch also, they may like to touch. Some children like to play with the food, the sticky kind of food or semi-solid kind of food. They'll just rub it and put it on their body and just play with it. But in some cases, children don't like touching the food. If it is a very sticky consistency, they may just touch it and rub it somewhere because they cannot tolerate that. And there could be oral defensiveness. That is, it can sometimes result as a result of force feeding, etc. They may don't like food touching their lips or their oral area. They may be aversive to that. So certain materials like steel spoons, etc. will be very intolerable for those kids. And they may be sometimes, in case of due to seeking, they may like stuff their mouth and keep the food in their mouth without swallowing for long, so that they could get the feel of that fullness in their mouth. That can also happen. Proprioception. Proprioception is the movement, the way your jaw moves, your tongue moves, the amount of movement. So when you are taking food and bringing it to your mouth, you know how much you are opening you have to give for that food to bite it and chew it. So all these awareness comes under the proprioception. So that could also be affected in children with autism. Now, introception. Introception is like your internal feeling. That is, if you have some pain in the stomach, or if you have some toothache, so that time you don't feel like taking in food. Similarly, children with autism, especially those who are non-verbal, they may not be able to communicate what is happening within them. So that time they will show aversion to food, or they will avoid mealtime. And also sometimes the feel of water running through their throat will be creating some kind of an irritation in them, and during that times what they do is they avoid drinking water. We've seen in a lot of kids with autism, they avoid drinking water, maybe due to the sensory issues. And vestibular issue. Vestibular is kind of, you always seek movement, you will not be able to make a correct posture. So that happens in children with autism also. When you have vestibular issues, they are not able to maintain a correct posture. So with support, they'll be able to maintain a correct posture. If that posture is obtained, they'll be able to better enjoy the meal time. Auditory can also cause a lot of issues. Like some children may not be able to tolerate some sounds, like the sound of the spoon and the plate. That could be some annoying for them. Or if they are sitting near the kitchen or somewhere, the sounds that are coming out from there, all these could be causing irritation. And also the sound of chewing. We know that when we chew different texture of food, it is creating different kinds of sounds. So this could also be difficult for them to tolerate. And muscle tone. If the muscle tone is affected, like some children or most of the children with autism may be hypotonic, so they will not be able to maintain a good posture. They will not be able to bring hand to mouth or spoon to mouth movements will be difficult. Closing the mouth will be difficult. So all these can happen when there is a affected muscle tone. Now let's see how can we tackle all these issues. So if your child is having undersensitivity, if the child is having undersensitivity, monitor for the ingestion of non-edible items. Like they will be eating whatever they get. They'll have a lot of mouthing. Like they'll put everything in their mouth. Even they try to bite on wall, etc. in case of severe conditions. So in this case, you have to be very careful, and you have to substitute their chewing urge with something that is socially acceptable. That is, you can give some crunchy carrot sticks or chew tubes, etc. for them to chew. So it would be good if it is during the non-meal times, you stick on the chewy tube or something of that sort, because giving food in the non-meal times would create a maladaptive eating behavior in them. If your child prefers strong flavors, you can give some extra seasoning to your child so that he can enjoy more of that flavors and enjoy the mealtime as such. And also a move and sit cushion can be beneficial for children who have vestibular issues, who have difficulty with the posture, so they can enjoy their movement, and also movement seeking will also happen. They can also enjoy their meal time. And if your child is having oversensitivity, deep touch pressure and proprioceptive exercises needs to be given, and you can talk to your occupational therapist in detail as to what are your child's individualized. It should be given in an individualized way, and so you can talk to your occupational therapist and find out what all are the best exercises suited for your child. And so prior to mealtime, if you are providing this, they will be able to enjoy their mealtime. And also, if the child is very sensitive to smell and taste, then you need not give that. They may like having rice without any curry. So then you can give, you need to be very particular, like your child has to have food in the way that you insist. That is, he has to mix the curry with the rice, and then in between he has to have the vegetables. No, there is no hard and fast rule like that. If it is in a socially acceptable and well-mannered way, it is always okay to have in his or her own liking, the way they have their food. So you can give the curry separate, the seasoning separate, so that they can have as and when they like. And also you can use natural food coloring. If they are more visual seeking and they like to have a lot of colors in their food and very bright colored food is more appealing for the child, you can use natural food colors, or you can use colorful vegetables or fruits. You can add that to your child's diet. And also you can observe the reaction of your child for different textures. So sometimes some children are more accustomed to eating hard textures, and some are more comfortable with soft textures. So in this case, you have to talk to your feeding therapy team and find out how you can work on this and normalize the way your child is having food. When you are introducing a new food, you cannot introduce it all of a sudden and insist that your child should have that food. So you should give your child his or her own time to have or adjust to that particular food. So you can do it in a very slow, step-by-step manner. Like you can take it outside the meal time and make it a play. Like take the new food that you are going to introduce, take it outside meal time, play as a tasting game, or kind of feeding your favorite doll. So then the child gets to smell the food, to touch the food, etc. And slowly, step by step, the child is coming, looking at the food, slowly touching the food, and then slowly putting small bits and particles in the mouth, and slowly the child will start having the food that he earlier didn't used to have. So this should happen in a very slow and step-by-step manner. Then develop jaw and mouth stability and strength should be improved. For this also you can talk to your feeding therapy team and find out what all exercises has to be done and what all are the issues that your child is facing in this regard. And also you can use a napkin. As we have discussed earlier, there are some children who have a tendency to rub their hand whenever they touch the food. They rub their hand against their cloth or on the table or somewhere. So then you can teach them appropriately, that give them a napkin and ask them to wipe their hand on the napkin and tell them that this is the appropriate way to do that. So that can be done. And also adopt cutlery and cookery that is best suited for your child. You can talk to your occupational therapist or the feeding therapy team to find out which is the best suiting for your child. And also sometimes you need to modify the environment. That is, sometimes your child will be happy to have meal in a dim light, or sometimes he or she may be interested in listening to a very soft music. So all these you can find out from your occupational therapist which is the best for your child, and make necessary environmental modifications so that your child can enjoy every meal. And also you can start with a quiet room. If your child is having a lot of auditory disturbances, it is good to plan his meal in a quiet room, but you have to slowly move into group settings, because you need to train your child to have meal in a group as well. Now there are also other issues that cause problems in feeding in children with autism. Let's have a look. One is social. That is, we know social interaction, lack of social interaction is one of the core symptoms of autism. So since they don't like to interact with others, they don't like having meal in a group or with all the family members, or other in school also they may not be able to adjust with other kids. So this could also be due to some sensory stressors. They are not able to tolerate the way you mix the food, or the way the smell of food that is some food that is being served. So all these also can contribute to this. Then routine. We know that children with autism are very adapt to routine. They follow a particular routine, and following routine gives them a lot of comfort. So if you can follow a very structured routine, that would be good. Plan their meal time, plan it on the same time every day, so that they have an awareness, okay, next is going to be my meal time. So when that is disrupted, they get restless and they avoid having meal. Structure. It should be very structured. When the structure is disrupted, also they feel very restless. That is, the room has to be structured. They feel that the plates has to be in a particular place, the glass has to be in a particular place. But this can be trained. They can be trained and we can change their behaviors. But to have a good meal time in the beginning, it's better to adjust to how it is comfortable for them. Communication. Communication is also a very great challenge for children with autism. That is, when they are non-verbal, they will not be able to say how much they want, or whether they want more food, or do they like the food, or is the food causing some stresses in them. So at that time we have to provide them some sort of a communication so that they could communicate whatever they feel like and enjoy their meal. Now, safety is also a concern when there is mouthing for your child. When the child tries to mouth everything, it is a safety concern. There are kids who chew and swallow rubber bands and things like that. So you should be very, very careful and manage feeding on non-edible or mouthing non-edible objects sooner you notice it. And cooking is also very important. Like, it should be well cooked, that is optimally cooked according to your child's need. It shouldn't be undercooked or overcooked. Some children like vegetables and all halfway cooked so that they can chew on it and have it. Some children like the food to be well cooked so that they can just mash it and have it. Then there are also behavioral causes for feeding feeding problems in children with autism. That is, when they are forcefully fed, or when they have oral sensory motor issues, but the parents doesn't know what all are the issues they have, and they are forcing them to adjust with that sensory problems. They start getting anxiety. So anxiety buildup will be there, and they will avoid. Due to this anxiety, the word food itself will create a lot of fuss in your child. And also, sometimes the child may associate the mealtime to some aversive stimuli that has happened in the past. Like a child who always vomits when he have food, he may associate food to vomiting, and he may not like having food. So in these cases, you can discuss with the psychologist in your feeding therapy team and find out what could be done. Now let's look at some easy ways to tackle these feeding issues. First is ease into mealtime. So mealtime, what you can do is, instead of forcefully feeding, you can just slowly, step by step, you can get the child to have food. Understand your child's feeding issues, the issues that are leading to feeding. So talk to the professionals related, and then find out what could be done and act accordingly, so that your meal times will be more happier for your child and for yourself. Now sit together at the mealtime. That is, family meal times are always good. Initially, the child with autism may not be okay to sit with all family members for meal. So slowly, with the help of the professionals concerned, you can get them slowly into the meal time. Here they learn a lot through imitation. That is, they learn to serve food, they learn how people are having food, how they are having in an appropriate manner, how can have food without spillage. So all these, through imitation, children learn a lot during these family meal times. And also support your child's posture. Posture is very important for having food, while having food or during mealtime. So find out what is the issue with maintaining the posture, correct posture for your child, and give appropriate seating support, and get him enjoy their mealtime. Have set times for meals and stick to them. So you have to have a particular time for meal every day. That is, 10 o'clock you are giving breakfast, means every day 10 o'clock you try to give the breakfast. 2.5 hours of break should be given in between one meal and the other, because there are parents who keep on feeding the child, so that since the child is a picky eater, the child shouldn't lose nutrients, so they keep on feeding the child. So this is a wrong way. We should create a good feeding behavior in your child. So every 2.5 hours you can plan the meal time. Now ignore challenging behaviors that are shown during the meal time. That is, if the child is showing some running away, or doesn't like to sit in a place, or spilling a lot, so this time, without overreacting to your child, you can start talking about the food, how we can have the food, how tasty the food is, what is the color of the food, and about the food that he had earlier, his favorite food. So you can keep talking about food. It is very important to establish a responsive feeding with your child. During responsive feeding, you can talk to your child, look at your child's eyes, take in the cues that are given by your child. It can be appetite cues, fullness cues, so you know whether your child is hungry at that point of time, whether your child is full at that point of time. So you get to know a lot of things, and also your child gets to know about the food, the taste of the food, the texture of the food. You keep talking about the food. There is a very good bonding and relationship being built with the mother or the whoever is the caretaker and the child. And we get a lot of cues for hunger and fullness from children. That is, when the child is verbal, he or she is able to tell that Mama, I am hungry, or Mama, I am full, I don't need more. But when your child is non-verbal, in case of children with autism, when they are non-verbal, they are not able to communicate. So you have to find out from the cues. When the child is not having an appropriate means of communication, you have to find out from your child's behaviors whether the child is hungry or full. So let's have a look at the hunger cues. The child, when it's a younger child, the child coos or makes giggles or makes some noises, walk around the mother, starts crying or be fussy. Or sometimes it's an older child, he or she may take the plate and come to the mother, or come and sit near the mealtime table. So all these are cues that the child is hungry. So you should be very particular that you don't miss out these hunger cues. It is their internal appetite sensation that is telling them, so we have to catch them. And fullness cues. When your child is done with the meal and he or she doesn't need more, then they'll be like interested in lack of interest in food. They'll start looking at whatever is around them. They'll be talking about the environment or something else, or getting attracted to something else, and the pace of taking in food may come down, and all these are signals that your child is full. And when does a non-responsive feeding happen? A non-responsive feeding happens that once a child shows a fullness sign, the mother will say, no, one more mouth or two more mouth for Amma, for Acha. So when this happens, the child is forced to have food. Or when your child is made to have a food that he or she doesn't like, forcefully fed, there is no responsive feeding. And also when you are leaving your child and going away, giving some food in front of the child, nobody is attending to the child doesn't have any communication with the food. So at that time also there is no responsive feeding. Now, what are the methods to adopt responsive feeding practices? You sit with your child while the child is having food. Talk to your child about what the food is, what all the child is eating, what is the texture, what is the color of the food, etc. Look at the child's eyes. Ask if he or she, every mouth you can keep asking, okay, shall we have the next mouth? You're done with chewing. Let's finish swallowing. Okay, let Amma go to the next one. So you can count the number of spoons being eaten. So all these get your child feel that something is happening between mom and me. There is a bonding created. When you're practicing responsive feeding, there is a good bonding created between the mother and the child, or the parent and the child, and this boosts the child's self-esteem. It makes the child more independent, more happier, and the child enjoys mealtime a lot, and it helps in overall personality development of your child. And also there is a lot of trust that is getting that forms between, especially when you understand the fullness cues of your child recognizes you as the person whom they can trust and come whenever they have some problems. So that trust is created when you are giving them a good responsive feeding. Feeding issues are multifaceted and often requires a interdisciplinary team of pediatric feeding specialists to address the physical and behavioral aspects of the problem. Often the team includes occupational therapist, speech language pathologist, and a psychologist. Always try to establish responsive feeding with your child so that you can make meal times enjoyable for you and your child. Thank you.